Hello everybody, my name is Professor Chloe Orkin and I'm a doctor and researcher in London and former chair of the British HIV Association. My focus is on health equity and new HIV treatments. In other words, making sure that everyone has access to new treatments and innovations. New HIV treatments are being developed. Some will be long-acting. In other words, treatments that don't need to be taken every day. We want to understand whether these new treatments are being offered equally to everybody. So, chaired together with the wonderful Angelina Namiba from 4M Mentor Mothers and with an incredible steering group of people living with HIV in 17 European countries, we've designed a study called Ask Us Europe. The study is also being done in partnership with EATG and UK CAB. So we asked people living with HIV about their experiences discussing new treatments with their healthcare providers through an online survey. We asked if healthcare providers are discussing options to modernize HIV treatments to simpler tablets or long-acting injections. Currently, the only long-acting regimen available in Europe contains two medicines, cabotegravir and rilpivirine, and is taken every 2 months. People with HIV have previously shown strong interest in long-acting options. Yet, less than 2% of people living in Europe are currently taking long-acting injections for their treatment. So we want to understand why there is this big difference between people's interest in injectables and what's actually happening in the clinics. This study will show us if healthcare providers in Europe are discussing, offering, and prescribing new treatment options, both tablets and injections, equitably to everyone. At EACS, we are presenting the first cut of Ask Us, describing the first 620 participants. The survey included diverse participants from 18 European countries, including older people, cisgender women, transgender and gender non-conforming individuals, Black and Latinx participants, and recent migrants. So what did we find? We found that 60% of people have not had discussions about new treatments with their healthcare providers in the last year. For those that did have discussions about new treatments with their healthcare provider, long-acting injections were not necessarily discussed. 51% of participants reported that they had never discussed this specific option with their healthcare provider, even though many wished it had been discussed. Among those who had used long-acting injections, 78% had raised it with their healthcare provider. This suggests that if healthcare providers raise injectable options with their patients, this strongly influences whether or not they get it. We also found an inequity issue. Some people had never discussed new treatments with their healthcare provider, and this tended to occur more among people without higher education. But the study is still recruiting and will be open until January 2026. So more than 1,000 people across 18 countries in Europe have answered our survey. We know that people living with HIV are asked to fill in many surveys, and they often don't find out what the results are or see any clear benefit to participating. We believe that our research is different. We want this study to be directly useful to the people who participate in each country. So let me tell you what we plan to do with the data. In addition to presenting the overall results at places like EACS, we will also provide a report to community activist organizations and the doctors who are collaborating with us in each country. This report could help community organizations to plan their support activities. This report could also help doctors, nurses and pharmacists to understand people's perceptions of their medical consultations. But we can only do this if we have enough participants to get a readout. This means at least 100 participants would be a minimum per country. Unfortunately, this is not yet the case in many of the countries. Also, we don't have enough responses from cis women, transgender people, people from minoritized ethnic groups, older people and recent migrants. So we especially encourage these groups to respond because we are still recruiting. It's important to say that the survey is anonymous. Because inclusivity is so important to us, we've translated the survey into 18 languages, including French, European languages, and Ukrainian, Turkish, Arabic, Russian and Kiswahili to make it easier for people to participate. To find your language, please click the box where it says English on the top right of the front page and you can select your own language. I really hope that you'll feel that the survey is worth your time and feel motivated to participate. We believe it will help improve HIV care in Europe. Thank you so much for listening.